This morning, more than 300 new confirmed cases of the coronavirus are being reported in our area, 321 in fact. Kansas City, Missouri, that brings the total caseload to more than 17,000 since the pandemic began. See the orange bar here. Johnson County, Kansas is now over 18,000 total cases with no end in sight. In the 9-county metro area, we're also seeing more new daily hospitalizations on average compared to a week ago. In fact, leaders in Johnson County, Kansas will hold an urgent meeting today to discuss spiking case numbers and what this fall surge means for schools and hospitals. KMBC 9's Martin Augustine is live in Olathe ahead of that meeting. Martin.
Yeah, good morning, Cody. Ed Eiler, the chairman of the Johnson County, Kansas Board of County Commissioners, has called a special meeting of those commissioners for here at the County Administration Building to start at 1 o'clock this afternoon. And when they get together, they're going to hear from representatives from the county's public schools, representatives from the county's hospitals to talk about how these higher COVID-19 numbers are having an impact on their mission for education and health care. They're also going to hear from the county health officers here in Johnson County, as well as county staff, to talk about ways to try and get ahead of these numbers, courses of action that might try to help the county out with this spiking number. Currently, Johnson County's COVID-19% positivity rate is 14.7%. Now, that's a 14-day average. For comparison's sake, about a month ago at this time, that number was below 6%. Reporting live, Martin Augustine, KMBC 9 News.
That's a big swing, Martin. Thank you. Another local high school football program forfeits its season because of the coronavirus. Yeah, the Odessa Bulldogs have reported too many cases within the program, so the school district made the decision to call it quits. Odessa, though, was undefeated. They were 9-0 on the season, even scheduled to play Summit Christian Academy in Missouri's Class 3 district championship game tonight. Missouri Governor Mike Parson, meanwhile, says coronavirus rules are changing at Missouri schools. KMBC 9's Matt Evans is live this morning to explaining what exactly is changing and why. Matt.
Well, Cody, many of these schools remain in an all-virtual format across our area. That's the case here at Raytown High School, where high schools and middle schools in Raytown will be all virtual remote learning until the end of the fall semester. But students did go back to class at the elementary schools in Raytown last month. So now Raytown School District, along with every other school district on the Missouri side of the state line, is reviewing that new updated guidance from Missouri health officials that was announced by Missouri Governor Mike Parson yesterday. Previously, health officials had said that anyone that was in contact with someone or that was exposed to COVID-19 in a school setting must quarantine for 14 days. Now they are suggesting quarantine is not required for an exposed student or teacher if masks are worn and the school district has a mask mandate in place. The person infected with COVID-19 still must isolate, and people they were in contact with should be monitoring for symptoms. These new recommendations are meant to cut down on widespread quarantines and encourage more schools to require masks. Missouri education officials saying yesterday that the large number of students and staff members being required to quarantine has created a significant strain on many districts and families across the state of Missouri in these past few months. Now, these recommendations are just that. They are recommendations. It'll be up to each school district individually to review those guidelines and decide whether or not to follow that updated guidance. Live in Raytown this morning, Matt Evans, KMBC 9 News.
All right, Matt, thank you. Leaders of local school districts are reacting to the new quarantine rules with a request for families. Please listen. They are pleading with parents to reconsider their holiday plans. In Smithville, for example, 7 substitute teachers had to fill in on Monday. 4 of them were in just one school. There are staffing issues here. Smithville superintendent says in-person celebrations could lead to more infections, which then could lead to all virtual learning.
What I'm asking for is people like my sister-in-law to step in and say, I'm not sure it's a good idea that we do this in person.
Most local districts, including Smithville, Liberty, Blue Springs, Park Hill, and Lee Summit, are reviewing the governor's new guidance now. Kansas City medical experts say a coronavirus vaccine likely won't be widely available until this spring or later. Healthcare workers would likely be among the first people to get it. Doctors say, though, they are encouraged by this week's reports of Pfizer's vaccine candidate, which the company says is 90% effective. But they warn even if Pfizer gets the EUA, emergency use authorization, in December, distributing it to the public is a long way off.
The EUA is approved, and we have their release of, say, 30 million doses, which would only cover 15 million people.
Pfizer vaccine candidate requires 2 doses given a month apart. University of Kansas Health System and Children's Mercy Hospital are working with AstraZeneca on that company's coronavirus vaccine. Well, beginning this week, a special mobile unit was used to bring the vaccine trial to underserved and high-risk groups. It's scheduled to make stops at Truman Medical Center, Health Partnership in Olathe, and sites in the Wichita area. Health systems also postponing some elective surgeries to try to free up bed space. Doctors are working to see which patients can delay surgeries without risk to their health. Health experts see the rise in coronavirus cases and say we're nearing a crisis.
We're at a crossroads, folks, and we have a choice to make. And our choice will dictate how the next months or year goes for the health of the people you care about. And when you get overwhelmed with healthcare resources, it's not just the COVID patients who suffer, right? It's if you have a heart attack or a stroke, where are you going to go? So I'm with the hospital. Well, not the hospital's overwhelmed. Where are you going to go? That's the choice you face.
And it's a real situation here. University of Kansas Health System is also turning away patients from other states who are requesting transfers because of a lack of space. It's just one of many hospitals in the area dealing with capacity issues. Some are even dealing with staffing issues brought on by the pandemic. Stay with KMBC 9 News for the latest developments on the coronavirus. Stay up to date on air, online, and through our free mobile app.